Unit 5, Lesson 4. You're looking for tasks for U5L4 under assignments or on the weekly calendar. Today's date is the 13th of January. We'll start off with our usual kind of pair, share, and meets. The question for today is, if you had 25 hours a day, how would you use your extra time? So in other words, if you had 1 extra hour a day to dedicate to something that you want or like to do. So think about the things that you feel like you don't have enough time for, or that you wish you had more time for. It could be sleep, it could be a hobby, it could be movies, it could be whatever. But just, if you had an extra hour that you could dedicate to something that you wanted to do, that you feel like you don't have enough time for, what would that be? So think about that for 20 seconds. And don't forget to say hi and check in with the person you're in the room with as well. We'll come back together in 2 minutes. Rooms are open. Docket is the usual COVID in the news and homework review. So just share my screen here. I've got a couple articles that I posted here recently from the news. Here's our world in data. I know I keep showing you the US numbers, but I figured I should actually start showing global numbers because we have a global student population. And so here are the global numbers. And I don't know, kind of surprisingly to me, the United States is actually technically not in the lead right now in terms of cases per million people. The UK is actually ahead of us. They have been suffering from an outbreak of the new strain, the mutated strain, which isn't more deadly, but it is more contagious. It is starting to spread now in the United States as well. I think it's in 9 states, including here in California, which is unfortunate. So US numbers are also climbing a little bit. And it is interesting to see kind of the November, December holiday spikes that we're definitely seeing, as I think people let their guards down over these holiday weekends. When I was reading through the news, I came across a cool, funny word, COVIDiot. Maybe some people have seen this before. I hadn't seen this word used before, but apparently it's in Urban Dictionary and is starting to be widely used, but it's a reference to people who are not adhering to social distancing or public safety guidelines, especially during the pandemic. So I thought that was kind of entertaining. And then the last link is to The Week, which is a pretty cool news site or a magazine if anyone's subscribed to it, but they do have a page called 10 Things You Need to Know Today. This is actually from yesterday, but they did an update, and yeah, unfortunately right here, US coronavirus deaths surpassed 375,000 in the US. Total number of US so after a second straight record of weekly deaths, more than 22,000 people died of COVID-19 in the past week, which is crazy. Nation's 7-day average reached 3,249 on Sunday. Worsening statistics followed a record surge of new cases and hospitalizations. Healthcare facilities are struggling to keep up with rising numbers of patients and administer vaccinations. Joe Biden has made one of his kind of first 100-day goals is to perhaps enact what's called the Defense Production Act, where they can basically force a lot more resources to be put towards getting the vaccine out and getting more produced. So we'll see what happens, but especially, I don't know if anyone's following, specifically Southern California right now is being hit pretty hard. So if any of you are down there, please be careful. In homework, the oceans article looks good. I'm seeing 13 attempts on that with 100% on almost every single question. The contagion reflection one also looks really good. Remember, you do have up to 10 attempts on those. And so if you mess something up, you can retry them. So pretty crazy about viruses in the ocean, huh? But why do, like, a lot of you are surfers, so why do you not have to be worried about getting sick while you're surfing the ocean if there's literally hundreds of thousands of viruses with every mouthful of ocean water you might accidentally consume? Why do you not have to worry about them? What do these viruses infect?
Is it fish and like mammals or something?
It might get in there, but think even smaller. Anthony?
The ocean microbes.
Yeah, so they infect bacteria, which I know, again, is a weird thing to wrap your mind around. But ocean water is full of bacteria and microbes, yeah, tiny little single-celled organisms. That is what these viruses primarily infect. There are definitely viruses that infect like fish and mammals and things like that as well. But I think what this article is getting at as being more widespread is these basically bacteriophages, right? These viruses that infect bacteria. There's this kind of war going on on a microscopic level constantly. But what's interesting is this article kind of takes a good look at the larger impact of this, because um, the behavior of these microbes of bacteria in ocean water can really impact something like climate change, right? It can really impact how much carbon dioxide is absorbed by it from the atmosphere into the oceans, how temperatures change. And so anyway, that to me I found really fascinating, but also just how much they really don't understand this, because they've only been looking at DNA viruses, right? Which we've learned there's a whole other family of RNA viruses, which is technically even bigger. And so they haven't even scanned for that yet. So anyway, this just struck me as showing how rampant viruses are. They're everywhere. They're a key part of life. And you know, I don't know the likelihood of any of these jumping into mammals or anything like that, but the fact that they're in ocean water also means that they're able to spread around the world quite easily through ocean currents and things like that. And I have another article for you guys to read that's kind of similar to that. So any other questions or comments or anything from that particular homework assignment about viruses in ocean water? Does it make any of you surfers think twice about getting into the ocean? Probably not, no. All right. So then the next quiz was all about contagion. We watched the first 20 minutes. So first of all, the kind of the big takeaways, looks like you all did fine on that on the reading or on the quiz, but what are the symptoms of this fictional disease? They end up calling it MEV1. But what were some of the symptoms you guys noticed that they showed in the first 20 minutes?
Fever.
Yes, so definitely high fever. Rory, I saw a hand.
Seizures and like foaming at the mouth.
Yeah, that seems to be this theory, is like there's foam, like, yeah, froth coming out of the mouth. Yeah, seizures seem to be the symptom for the first two. Jackson?
Their eyes swelled up and got really red.
Yeah, they show that in some of the bodies. Does anyone know if you're listening to in terms of what they're dying from? They refer to encephalitis. Does anyone know what that means? Encephalitis? Yeah, it has to do with the head and the brain. So it's basically swelling of the brain or brain damage, and so that's also why they show you pretty crazy scene when they're chopping open Beth Emhoff's head. It's Gwyneth Paltrow, and they bring the brain back to look at the base of the brain, and you know they don't show you what they're looking at, but the two autopsy guys are like shocked that basically I think the brain's either swollen or basically destroyed, like all mush. This is what a lot of diseases like this could do this to your lungs or your brain. So clearly, whatever this virus is, it's infecting the brain in particular, but it does seem to be spreading really quickly, which is indicative of something probably being airborne. But again, we'll find out more in the next 20 minutes that we watch. Okay, next big question I want to ask. So we've got key symptoms down that they're showing. The next one was the characters. So just making sure you're feeling comfortable with who certain individuals are. I have images on there. So Matt Damon's character, what's going on with him? What's unique or special about him?
He's immune to the virus.
Yes, which is, you know, seems like a convenient plot point, but actually isn't that far-fetched. You're going to have a homework reading for tonight about how there have always been people resistant to even some of the most major diseases, HIV, Ebola. They've always documented people who, for some reason, get these diseases and don't get sick or have been resistant to it. And it's kind of one of these mysteries that science is trying to figure out. So, okay, what about Dr. Ellis Cheever, Lawrence Fishburne's character? What's his role here? Take a guess at who he works for. There's a certain organization he works for.
CDC.
Yes, so he is sort of a manager and epidemiologist for the Center for Disease Control. He's like a disease strategist or something like that. I can't remember the actual title that his character has, but he kind of oversees the management of this pandemic. Okay, how about Jude Law's character, Alan Crumweedy? We haven't seen that much of him yet, but if anyone's seen the movie before, you kind of know what does he do? Sophia?
Is he the reporter guy?
Yeah, I wouldn't call him a reporter. He's a blogger, so he's sort of more of like an internet personality, media person. We do see him talking to the news and trying to share a story, but you can see he's kind of greedy. He's like, no, like this is my story. I want to benefit from this. So yeah, but he's kind of like a internet blogger character. Okay, what about Dr. Leonora Orantes, Marianne Cotillard's character. We saw her right towards the end of those first 20 minutes. Hint I'll give is that you've mentioned Lawrence Fishburne works for the CDC. She works for another pretty major health organization. Gabby?
World Health Organization.
Yeah, so she's an epidemiologist with the World Health Organization. So we're going to see her overseas more. Lawrence Fishburne is based in the US. We'll see her traveling around Hong Kong and stuff. All right, then what about Kate Winslet, Dr. Erin Mears? Who is she working with in particular? Anthony?
I was just going to ask if she's like working in the Michigan Department of Health or something like that.
Yeah. So she's working with Lawrence Fishburne's character with the CDC, but she's kind of like the agent on the ground. She's managing the actual like teams and areas, trying to assess the situation, calm people down, and figure out like how it's spreading within the U.S. So cool. Okay, well, we're going to pick up then where we left off. As before, there is another contagion reflection. If you look at tasks to complete, the numbering is messed up. It should be 6. It's listed as number 2, but it's right towards the bottom after my contagion part 2 of 5. So you can go ahead and open that up if you want to look through the questions. Specific things I want you to pay attention to in these next 20 minutes are the specific settings that the director chooses to show the characters in. There's some interesting stuff going on there. The motivations of the main characters. You're going to start seeing what drives each of these people and why they're doing what they do. And then characteristics and identity of the fictional disease. So again, you're going to learn a lot more about this fictional MEV1 and where it comes from, what it does to people. Okay, any questions or comments on that? Where you're going to put the different websites that you have referred to. And I don't mean just URLs, like I want to have the actual title of the site that you add a link to. So again, this is a draft. You don't have to have everything here that you're going to reference to. I just want you to get started on this. To help you, I've listed a couple resources here that are pretty general, but I think are worth exploring. So there's a history of health and sciences links from MLA. I'm trying to remember what that stood for, but it's a great collection of links to different other websites and educational things all about diseases and history. The History.com History Channel website has a great article on pandemics that changed history. There's another kind of online article called The Conversation, which has a good one about how infectious diseases have shaped our culture, habits, and language. And then Britannica, CDC, MSD, they all have great A to Z indexes about diseases and conditions, and they do sometimes mention the historical impact of those things. So those are all good resources for you to check out. But otherwise, just follow the instructions there and submit a link just like the previous assignment. So I'm going to time for, let's just go ahead and say 10 minutes. And then we'll come back together to reflect and end things. So 10 minutes to work on your magazine article. Let me know if you need help.